Welcome to the Breaking Barriers to Exercise e-presentation. My name is Stewart Kerr. I'm a Chartered Physiotherapist at LifeFit Wellness. So before we look at how we might break barriers to exercise and help people to engage more with exercise, we first need to look at why we might want to exercise in the first place. So there are lots of general health benefits, so reduced risk of heart disease and stroke, reduction in type 2 diabetes, colon cancer, breast cancer, reduced risk of early death. There's also, interestingly, a very significant reduction in the incidence of osteoarthritis. There's a reduced risk of hip fracture, often related to improved bone density and reducing falls in the elderly population. And very importantly, there are significant mental health benefits from regular exercise as well. But there are also specific exercises in addition to the general health benefits. So it might improve sport or exercise performance. We may look a little bit better as a result of it, although that might be debatable. And rehabilitation from illness or from injury. So there is one prescription that can provide evidence benefit for a whole host of different conditions, from low mood, decreased confidence, stress, anxiety, long-standing pain, insomnia, cartilage issues, being overweight, osteoporosis, weakness, back pain, arthritis, tendon problems, sprains, strains, dislocations, shoulder pain, cardiovascular disease, heart attacks, stroke, poor colon function, breast cancer, diabetes, life expectancy, abdominal fat, metabolic disorders, and it is physical activity. And if you could package it up like a pill, everybody would be taking it. But it's perhaps not quite that simple. And often there are barriers in the way of people engaging with exercise. So what might the barriers be? Well, it could be injury, whether it's a current or previous injury, and other people's experiences and perhaps fear of developing an injury through exercise. Illness, including surgery. So we want to look at how we can actually help people to break down barriers. But there are certain general barriers towards exercise, such as family and time commitments. But we want to make sure that people can prioritise. You can look at time management, we can look at the environment, remove distractions. Too tired, it's very common. We often have busy jobs, we come home and we feel mentally quite tired. But exercise can indeed increase energy levels and improve sleep. There's a lack of exercise can make you feel more tired and therefore less likely to exercise, so it becomes a vicious cycle. The important thing is to start small, feed off the small benefits, and that will help to break that cycle. So some people might say they don't have the willpower, but try to find something that's reasonably enjoyable, at least something that you don't detest. Trying to get involved with friends or in a class can be very helpful, and you can feed off the group motivation. Some people just don't like exercise. They've maybe had bad experiences in the past, potentially stemming back to childhood. But remember that exercise comes in lots of different forms. It doesn't need to feel like exercise to be exercise. It can feel like hard work. Yeah, it can be, but it doesn't have to be. Start easy. Walking is possibly one of the best forms of exercise, particularly to get started with. So that could be if you drive to work, look at options for parking the car up a little bit short and making a walk the remaining distance, both to work and returning back to the car following work. It could be a short lunchtime break. 15-20 minutes at lunchtime is better than nothing, and there's no better way to clear your head, refresh yourself, and have a productive afternoon. A gentle exercise class might be a good starting point, whether it be a beginner's yoga class or aquafit, something like that. Now we do live in Scotland, and the weather sometimes isn't conducive to exercising all the time outside. But essentially, as the saying goes, there's no such thing as bad weather, just bad clothing. So embrace the elements, get wrapped up, get the appropriate gear on, and actually sometimes it's a really good challenge to battle the elements. You can have indoor alternatives. You don't need a lot of space to do some activity. Small space in the living room is sufficient to allow you to engage with perhaps some gentle squats, knee bends, marching on the spot. All of these things are really good ways to get started engaging with exercise. So I've missed a few sessions and now I've given up. I've tried and failed in the past. Perhaps looking back, you maybe set some slightly unrealistic goals. That's very common. So this time around, we maybe want to look at setting some more modest goals and get a sense of achievement, no matter how small, and use that as momentum to build going forwards. Maybe we want to look at an alternative form of exercise. It might be that you tried a previous form of exercise that wasn't enjoyable enough to keep you motivated, and then you disengaged with that particular activity. So look at alternatives that might be out there. So I don't know where to start, and that is very understandable. It can seem like a minefield out there. The fitness industry can be quite flashy and for a lot of people quite daunting, and there's lots of different options. So where do you start? Trying to seek some reputable professional advice, whether that be from a trusted or recommended personal trainer, fitness coach, or indeed from a physiotherapist. Pick a simple and easy and accessible activity and start with a beginner class or indeed a one-to-one session if you prefer. Small group classes offer the benefits of a class while still having good instructor to pupil ratios, so you can get the confidence to engage with that activity safely and effectively. Goal setting. Perhaps one of the most important things about engaging with and sustaining an exercise regime. We need to have long-term goals. Now that can be in sporting terms, I want to win a competition or win a medal. But for general life, it may be that we want to maintain a health into our older years. Or it could be that you want to feel fit and healthy for a forthcoming wedding. But these goals are often very emotionally driven and don't often give you the specific daily guidance that you need. So it's all very well saying I want to win an Olympic medal or I want to be thin next year for a wedding. The most important question perhaps is how are you going to achieve that? And that comes down to the more objective short-term goals. SMART goals are very tried and tested, and we know that when people use a framework like SMART goals, they are much more successful at engaging with their chosen activity. So SMART is the acronym and it stands for being specific, measurable, achievable, realistic and timely. So you can have a read through those, and there's lots of online resources that can guide you through setting your own SMART goals. So specific barriers that may prevent people from engaging with activity are injury. So physiotherapists are well placed to assist with this. They can assess the injury itself, perhaps give you some rehabilitation exercises that may help you to address that particular injury, but also look at ways to facilitate engaging with longer term activity. An illness, including surgery, can obviously be a challenge for people to overcome. But again, physiotherapists, but also perhaps sport and exercise medicine doctors are very well placed to look at things from a medical perspective, but also looking at exercise and using their particular knowledge and expertise at helping to facilitate a transition to a healthy, active life. So at LifeFit, we do have a number of services that help people to engage with activities and perhaps overcome some potential barriers to exercise. And they are physiotherapy, which can be done on a one-to-one basis. ChairFit, a fantastic class which is centred around the chair but not exclusively sitting, and is physiotherapist led. Forever Fit is a class for people into their older years and uses gentle exercise to engage with some strengthening, balance and cardiovascular exercise. Small group class led by a very experienced exercise instructor who specialises in older person's exercise. There's yoga at the clinic. We have hatha yoga, mindful yoga, and we also have physio-led yoga, which is particularly beneficial for people who do want to get some additional assistance to help perhaps with an injury or a previous painful condition and facilitate their yoga journey. Pilates, we have a really extensive program of Pilates classes, but also one-to-one sessions as well. We do have specialist large equipment, the reformer and traps table. We have general classes, which again are small and they're physiotherapist led. And we have our performance Pilates, our studio equipment Pilates, to challenge people a little bit further. There are other classes such as PhysioFit, which is again physiotherapist led. People use that if they want to help condition for a particular sporting activity, whether that be running or a racket sport. But it's also heavily used by people who are perhaps progressing through their rehabilitation journey, and it's a way to help facilitate further progression of their exercises while still under the guidance of a physiotherapist. The class essentially is designed such that it can be modified to address your individual exercise requirements and perhaps accommodate some injury history. Nordic walking is a great way to get outdoors and to maximise the benefits of walking. It's walking with specialised poles, and it's been adapted from cross-country skiing. So it is different from your traditional walking pole. And rather than the poles being in front, the poles push slightly behind you, which is a great way for engaging through the whole shoulder girdle, the abdominals, and the legs. And research in this area has shown that people have a significant increase in their muscle usage and their cardiovascular function in comparison to regular walking. It's not to dismiss the huge and wide-ranging benefits of regular walking, but if people are looking to push on a little bit, or indeed to accommodate perhaps some painful lower limb conditions, Nordic walking is a really nice way of engaging the whole body a little further and perhaps offloading the lower limb just that little bit. It's often described as Pilates upright and outside. Backfit is another specialist class that we have, and it runs periodically. Again, physiotherapist led, and as the name suggests, it's for people who perhaps have had back problems in the past and are looking to proactively manage things in the future. So the key take-home messages from this presentation. First of all, exercise is great. It has so many wide-ranging benefits, and again, if we could package it up in a single pill, I'm sure everybody would be taking it. But hopefully through this presentation you will have gained some useful information as to how you can engage with exercise. Exercise comes in many different forms, and start small. Don't bite off more than you can chew. Make exercise fit within your current routine to begin with, and try to make it fun and sociable where possible. If you have any specific concerns, you can seek professional advice and try to set some smart goals. So we won't be taking questions in this particular forum, but if you do have any questions, you can email them into the clinic at info@lifefitwellness.co.uk. I hope you've found this enjoyable and beneficial.